Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurvich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
All right, so we're back, everyone, for some fascinating cases on constipation that Dr. Sand is going to guide us through. Dr. Sand, do you want to start?
Do you think that we should
do.
exclusively just talk about constipation? I feel like it's all that anybody cares about. Every middle-aged, person, constipation.
Adolescence, menopause.
Kids.
People are constipated out there.
We should
Drink
just
some
call ourselves
water.
the constipation nerds.
They should put
Yeah.
flax and chia in the water. You know how they talk about putting certain medications in the water? I feel like
I have a feeling that would be significantly less palatable.
It's super gross.
Yeah.
But I see what you're getting at. I think they should put melatonin in the water in the evening.
All
Or
right.
lithium orotate. You guys ever read the studies on lithium orotate?
Oh, yeah.
It's where in areas that it's naturally occurring, there's less homicides, there's less suicides, there's less violent
Huh.
crimes, and it's just naturally in the water.
We're gonna have some weird water.
Well, we already
I mean, we
that
have
in there.
parasites in the water, so
True.
only in Portland, Oregon. And
Yeah.
lots
That's
of
not
other-
true.
yeah.
And many different countries
That's
in the
true.
world.
That's true.
And
But-
cities in the United States.
but definitely in Portland, Oregon.
it's better than lead or something. you know.
Word
True.
up. That's a good point. Good point.
Yeah. Well, okay. So I have a 26-year-old male who was diagnosed with IBS-C before coming to me. Anybody want to recap on what makes somebody have IBS-C versus chronic idiopathic constipation?
Ooh, oh my God. The
They
best
have
person to do
pain
this.
and constipation.
And they have
Okay.
less than 3 bowel movements a week.
And the
those
criteria?
specifics. Yeah, it's like 6 months. I mean, in either case, you're supposed to have issues for 6 months and decreased frequency. But the thing that makes you in the IBS camp is the pain.
That is relieved by the
s-
bowel movement in some part.
It's just pain associated with bowel movements. Yeah, and it can be, increasing in severity, staying the same, worsening. It doesn't really matter, but pain with it. Otherwise, you're just constipated.
And we can
No,
assume
it's irritable.
if he had that diagnosis, everything else was ruled out, like a functional constipation and like what's the name of the constipation? Outlet dysfunction constipation.
Well,
been
I
ruled
don't,
out.
we
Which is
probably
a-
shouldn't assume they've been ruled out. Or maybe they were ruled out by Dr. Sand.
Yeah, they were definitely not ruled out, but outlet dysfunction or pelvic floor dysfunction is a subtype of chronic idiopathic constipation. But he came to me, I'm just starting with where he came to me on this case. So 26-year-old male came in with a diagnosis of IBS. It was a 3-year history, and notably it started during a time of high stress.
Mm.
And I'm sure you too always
That's a
ask
thing, yep.
patients, why do you think this happened? Like what was going on at that time? That may have, that was pretty key for him because he was not really aware of how mood and lifestyle stuff really affected bowels, but that was the start of that conversation together. So his GI put him on polyethylene glycol, which is
AKA
Miralax.
Miralax. Yep.
Yep. And that helped 60% with bowel movements. So improving the frequency of spontaneous bowel movements. But he preferred to avoid it after Googling some of the ingredients and was looking for natural alternatives. And it did absolutely nothing to help with abdominal pain.
It never does.
Yep. So he, still, even though he was having better bowel movements, he was still spending about 30 minutes or more on the toilet. He would have the urge, but would need to strain to get it out. And, was going anywhere between a Bristol 2 to a Bristol 4 scale. And associated for him was generalized anxiety disorder that he was diagnosed with.
And was
Do you
he
want to
medicated?
recap sorry, Dr. Gurvich, go ahead.
Was he medicated for the anxiety disorder? Just out of curiosity.
he wasn't.
Okay.
He took meds in the past, but he wasn't currently medicated. He was doing better with it. It was really that period previously, 3 years ago, when there was some family loss and things were really stressful in college and whatnot. And he took medications then and was not. He was better.
What were
Didn't
you
need it
saying,
at the
Ami?
time.
Oh, do you want to recap what a Bristol 2 to 4 is for those of us that don't have it like on our coffee mug and hanging in our office, like
Or
some
a
people?
tattoo of it? Wait, there are
Who
people
would
that
not
don't-
have it on their coffee mug? Who are these people?
I mean, so I have this great diagram that I just recently realized was for children, but it was so
Oh.
good that I actually have to download it and every patient sees it. Bristol 1 is like deer pellets. Bristol 2 is like a bunch of grapes. Bristol 3 is corn on the cob. Bristol 4 is a sausage. Bristol 5 is chicken nuggets. Bristol 6 is porridge. Bristol 7 is gravy.
I'm never going to completely memorize it, so I guess I should get the infographic
I'm
on my
also
laptop.
never going to eat those foods again.
You're welcome. That's
Thank
the
you.
best I can do.
Maybe we should get t-shirts, then I will remember it, because I'll see it like enough times that
Yeah, it's actually every single one of my patients, it's a very useful tool. Bristol 1, Bristol 2 is constipation. Bristol 3, Bristol 4 is normal. Bristol 5, Bristol 6, Bristol 7 is more progressive diarrhea.
Yep, I brought a family member to see Dr. Gurevich, and they were a bit embarrassed when the computer was turned around and they were asked what their stool consistency
Again,
was.
you're welcome.
Yep. What do you look like? What does it look like? Yeah.
And then some people will say, I don't look. And I'll be like, how could you not look?
I know,
Yeah.
but apparently it's not normal to look at your stool for most people.
Yeah.
Who knew?
That's when their lives are changed. When we tell them if they want to work with us, you're going to be looking at your poop.
You got to figure out
We
what's
need
going on in there.
details, people. Details.
Very important.
Okay. So this person, this is the reason I like this case is because I got to dig a little bit deep here. So first, all I did with him is put him on psyllium husk to get bowels moving. And I always do a titration with people. I joke with my patients, psyllium husk and adequate hydration could probably put me out of business. It works really well for me. So I started him at 2 caps daily, slowly increasing to 3 caps twice a day.
You use capsules.
Compliance is way higher with capsules.
Yeah, but you have to take so many.
You do. And I definitely have a chat with my patients that we're trying to put a food into a capsule, but the powder's gross and people don't end up taking it.
Are you giving it away from food or not worry about it?
I give it away from other supplements and medications because I'm worried about it binding and decreasing absorption. But I really just want people to get it in. So with food or without food, I don't really care.
It's such an interesting one. Sorry, Dr. Sandy, because it can help with diarrhea and constipation. It's
Yeah, I say it's a bowel normalizer. So it's not going to push you one way or the other unless you don't get enough water.
And it's good for detox too. It's a good
it's a
fiber
binder.
for
binder,
so for
it's good for
xenoestrogens and all sorts of plastics.
Totally. I use it a ton in hormones for people, hormone balancing, and I use it for cholesterol. I use it for weight loss support or weight management support. I've seen it even help with mental health because apparently, I don't know if you guys have heard of this, but there's a link between the gut and the brain.
No, shut up.
Yeah. News.
Why would you say that?
It just gets, I guess that one I don't use as much because it gets tricky because people are on meds and supplements. So it's just, you have to figure out when to get it in. But it sounds like your patients get it in.
I can sell it pretty good. I do pretty well with it.
So I was out to dinner with another awesome naturopath, Dr. Julie Greenberg, who's very derm and GI focused. And she was telling me her hack that she has patients do, which is they'll make a strong cup of sleepy time tea and put a couple of tablespoons of either psyllium or flax or chia, and it's like a sleepy time tea pudding. Why does
but psyllium
gross
that much psyllium is going to turn to concrete like that? You got to drink in about 5 seconds max. The other ones for sure.
You're not necessarily drinking it; you're spooning it, and then you're washing it down.
I think
I can get behind flax and chia.
Yeah, I think I'd probably dose the psyllium like when we would do binders for detox things, like first thing in the morning, last thing at night, mid-afternoon, when you haven't eaten for a while is probably best bet.
And then what are you doing? A tablespoon, a teaspoon when you were doing binders?
Oh, I wasn't using psyllium as much. I did have some people do the capsules that Dr. Sand mentioned. I think I might have been doing, depending on if they had constipation or loose stools, I would dose it differently, because I think I needed to use more for loose stools, I had to go up a bit more sometimes with the psyllium, I feel like.
Psyllium I like because it's a starting place for me before I go into microbiome testing and treatment. It's a good blend of soluble and insoluble fiber, which we need to normalize bowels, but it also is one of the few that doesn't ferment.
That's true.
Unlike pretty much any other option, I love, like, fibers are great. Get the fibers, but not a lot of people, especially when they're new to me, can tolerate things. And I don't want to, on our first treatment plan, send them home with something that's going to ferment worse in their SIBO that I haven't yet diagnosed.
Yeah, that's
That's a good idea.
So psyllium is a really gentle way in, and we go really slowly. But I tell folks that, like, my goal for you is to get this regulated and have you not dependent on this. Sometimes bowels need jump starting. This is a really gentle, easy, super beneficial in multiple systems way to do it. If you can just stick with it, stay organized, sometimes that's, we're good to go.
Yeah.
For
Did it put you
him,
out of business? Did this put you out of business?
yes, I'm retiring. Happy to report.
I knew it.
I also put him on enteric coated peppermint capsules, which is, peppermint oil that is coated, so it's not going to open until it gets farther down into the digestive tract. And then we had a huge talk about water. He was not drinking enough, so we did 80 ounces of water per day for him, and that was my first treatment plan. That was it.
Okay.
So he came back with that, and he was having he got up to 5 psyllium husk caps a day in divided doses. And he was having banana shaped bowel movements, one a day.
Great.
He was having
sorry, Dr. Sand, what dose did he get up to on psyllium?
just 5 capsules. And I think he was doing like 2 and 3 or 3 and 2 or something.
Yeah.
I tell people, like, once you get past 3 or 4, divide it up.
Yeah.
It's just a bit too much of a bomb. He was having fewer episodes of abdominal pain and was using the peppermint caps 5 to 9 times per week.
Okay. And they would work that quickly.
Yeah, I mean, it takes a little bit to get in, but it's usually, like, I'm fine doing it as needed. Sometimes if people aren't really remembering that, I'll say, just give me it once a day or twice a day. But he was able to do that. So
with food, I'm assuming. The peppermint oil?
I don't really care. It's sort of as needed, before or after. The only time I've seen it really backfire is if people have very rapid transit. So if I'm looking at like spastic colon stuff and they have extremely rapid transit, that oil will reach the rectum and burn.
That does seem very uncomfortable. I'm imagining
like
it right now.
People, yeah, I've heard of.
Yeah.
So, and obviously this guy was constipated, so that was not really the problem. But so, great, magic fix. He went on and lived his life, except that's not where I stopped with him. So I didn't want him reliant on all these pills because, it wasn't too much, but it was more than he needed. So then we kind of went into this conversation of, what's at the root of this, and what can we do to kind of reduce pressure with bowel movements and ease the flow of things. So we talked about gut-directed hypnotherapy.
I love gut-directed hypnotherapy. I love
There's a great app out there.
I don't love the app.
Lots of options.
Let's not name any names.
No.
Yeah, but that was an easy compliance thing for him. And their providers you refer
chunk
to?
it out. We should chunk out GI hypnotherapy, because if you look at the data on it, it is robust.
Yeah.
Yep.
And it is, in my experience, the patients that are gonna, like, I think about it, patients with, like, nothing touches them and they're in pretty severe pain. And then that's why I think I prefer to work with like a hypnotherapist, or mainly they're psychologists, who are trained in this particular species subset, because those people are also trained in a lot of different tools, because you can't separate the brain from the GI. You can't.
Yep.
And
especially with pain.
Yep.
I see that especially with any form of GI pain, whether it's visceral hypersensitivity or IBDs or anything like that pain. You really do have to be working the highway, gut to brain both directions.
Yeah. Oh, go ahead. I was just going to say, there's actually like several different apps and online programs these days. And I've seen some of them work quite well with people. I think it's just individualized if they need a one-on-one person, or if one of those programs works. And I've seen multiple different ones work for different people. So there's lots of options
complexity, like how complex are they?
Yeah.
Yep. Yeah. So I chose an app for him because it's like his age group is very tech based. That was like just what the profession he was in. It was a good fit. Most of my patients, honestly, with the apps don't come back saying they loved it, but they say it helped.
Yeah.
and that, they know they need to do it, and it's a really good resource they dip into sort of as needed. But I did that. I told them to continue the psyllium husk and the peppermint as needed. And then we talked about a squatty potty, non-negotiable for my patients. And we talked about, which I think we mentioned on this podcast before, diaphragmatic breathing during stooling. Breathing while you poop.
Can you explain what that is? That's a great resource.
Yeah, just breathing. I think a lot of people who have stress with digestion or stress or pain with bowel movements hold their breath, or they're not breathing appropriately while they're stooling, while they're actively having a bowel movement. So getting in the right posture with the squatty potty. And then I was showing him how to do some of our diaphragmatic breathing, just getting into that belly, and not just into the belly, but like expanding the entire rib cage while you're pooping, like release that pressure. So that was the second tier.
The Squatty Potty is just something you can buy online. There's like the brands, and there's a bunch of other like not name brands, but it's basically to try to get you ergonomic position for defecation. So basically the position that we would be in if we were squatting to have bowel movements like we used to do before we had chairs and toilets.
Have you guys experienced that?
That's what we had in India.
That's what we had in India when I first was a kid, and we would go in the visiting in the village. It was like a hole in the ground. I'm just curious if you guys have.
I lived in one of the places I lived in China. One of my I lived in a hutong, like traditional Beijing housing, where it's like a bunch of rooms around a shared kitchen, shared bathroom, and the bathrooms were squatty potties.
My husband tells this great story when he went to China. I also went to China and experienced this. And in fact, in China, the worst smelling toilets are the Western ones. Like the squatty potties don't actually smell, the hole in the grounds don't smell at all. But know, if you can smell a bathroom from like 200 feet away, it's a Western toilet.
People are using it.
But my husband tells this great story about when he was in China. He was doing a rotation down there for acupuncture, and he walked into the bathroom, and he was like, I saw the most Chinese thing ever. I saw a guy holding up a newspaper with a cigarette dangling at his mouth, and like the poop coming out his butt.
Oh God.
The doors were open, no privacy. He was like that. I think he was like, that was the most Chinese thing I ever saw.
Love it. Great.
Okay, last thing on this. My friend fell into one when she was a kid, and her grandma had to pull her out. Oh God.
Mommy, that's awful.
I know.
How do you survive that trauma?
I don't know if I made it up, but I feel like I have a friend who told me that this actually happened.
This is a reason, just to pause for a second, this is a reason we should probably do YouTube so people can see our face right now.
Oh my God.
Like utter shock. I am speechless. Blah.
Okay, moving on.
Now I can't. Now I can't move on. Thank you. I hope you're happy.
And I don't have good memories of using those. I do not have good memories of using those.
I loved it. I really liked it. I mean, they have the ones that are like porcelain, and they have like little feet.
That is not what we had.
That is not what I saw in China either.
I've used the bad ones. I've spent time in India and various places that it was a literal dirt hole in the ground with maybe some wooden planks over it for your feet. But
wooden planks. Yes, I saw those in Thailand.
Yeah, but in a lot of the places in China that I was, like, they had options with like toilets, like Western toilets, and then they also had the like porcelain squatty ones that are way more sanitary. You don't touch anything. You just like do your business and step on the thing, and you walk out, and the whole thing flushes with water. It's great.
Can we assume that generally, if you're in that position, those countries have less constipation?
Probably.
It's a good question.
Because of the parasites that they have.
I don't know.
Well, the turmeric and other spices help with the microbes.
Totally.
I don't know.
I think the goal is you just need your knees above your hips. Like anatomically, you don't need to go full on squat, although go for it. But I think you just need your knees above your hips.
Okay, that makes sense.
I mean, I will also say if as you age, if that is the position that you're taking for comfort, you know what I mean? Like you just have better longevity. Like that squat position is very, very healthy for the entire musculature.
Totally.
Totally. I call it orange therapy. I go to my workout classes and they have me doing like 100 squats. Like you just feel better if you're able to hold a squat.
Yeah, I would agree. I'll also say anytime we stay anywhere except my house, it's like a shock now because we have a heated bidet seat.
Oh, you do.
That's beside the point.
Luxurious. Yeah,
that's how I feel about my heated floors. I have heated floors in my bathroom, and I can never go back. Like I step on someone else's bathroom, like what is this inhumane floor?
you guys have to struggle. You guys need a little bit more struggle in your life.
Our life is really hard. I hope you feel bad for us.
I recommend cold floors and unheated toilet seats for
Oh,
sure.
well, do you want to hear how it ended?
Yes. Keep going.
With our 26-year-old constipated male. So I didn't see him again for a year.
Okay.
Which is either a really good sign or a bad sign, you know, but he came back and it was a good sign. So his bowel movements had totally normalized. He was having 2 to 3 per day. This isn't actually what he came in for. He came in, you know, for some manual stuff, but I asked because I cared how that went for him. And he said he was using psyllium husk as needed. So like travel stress, you know, work changes, things like that. And the thing that made the biggest, I think he didn't really need the peppermint anymore or whatever, but he said the thing that made the biggest difference for him was breathing while pooping.
Oh, it's so simple sometimes.
It's so simple.
Sometimes it's not, but sometimes it really, really is.
Well, I think, and one thing I have learned over and over again with constipation cases, because I'm like, you know, moth to a flame here. People just find me who can't poop, and I love talking about it, so come on over. But I think there's something to be said with jumpstarting the bowels, using our tools, even if they're medications, like whatever we need to get the rhythm reestablished. And then I see a lot of, and I have another case on this too, I see a lot of these other things become accessible then. Yeah. Like breathing may not have helped him initially, you know, but once we were able to get the tube emptying, then that stuff actually did play a role in him being able to just manage.
That's a great case.
Yeah, great case.
Let me just recap all of those really good highlights. Peppermint for oil, peppermint oil for pain is very effective. When you're having that nervous system, intestinal component, then think about the hypnotherapy because there's a lot of great data and high efficacy. And I will say that right now I'm like, oh, it's really broken. A couple of my really, really tough cases that I was stalled out at. Introducing the hypnotherapy personally has been really, really helpful. Don't forget about a mixture of soluble and insoluble fiber, and psyllium is not going to ferment in the bowels.
Great.
That was a great case.
Yeah.
Great case, and Dr. breathing.
Sam.
Don't forget how to breathe.
Yeah. Totally. Cool. I mean, I just think about like how busy our lives are where we don't even have time to take a minute to have, personal time. Like as a mom, I feel like there was almost a decade when I was never in the bathroom by myself because one of my kids needed something. You know what I mean? Like, it's like, don't forget, like that is a quiet, peaceful time.
It's so true. Yeah. You're saying that you weren't doing like your deep belly breathing while your kids were climbing on you.
I feel like I would like, just give me a moment. I will be with you in a moment. Just give me a moment.
Oh, it's the dream, isn't it? Living the life.
All right.
Okay, great.
Great case, guys. Dr. Sand. We'll do more in the future. We've got a couple more constipation cases coming up.
Totally. Thanks for tuning in.
Okay. Bye, everybody.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.